What are the coping mechanisms for adult children of borderline mothers when the mother's behavior only solidifies and intensifies?
When the mother's behavior solidifies or intensifies, she is very likely not a borderline, or at least not a pure borderline. As you have indicated, she is likely to suffer from other comorbidities which do worsen with age. So, for example, she's very likely to be a narcissist as well. Narcissism does not ameliorate or mitigate with age, with the exception of antisocial behaviors. All other features of narcissism become worse. So
fascinating.
So it's very extremely likely, actually, that this kind of person has actually shed the borderline part, but has remained with the narcissistic part, and now the narcissism is glaringly ostentatious and obvious. And that makes the situation a lot worse. We have an identical situation with dementia. You've mentioned dementia?
Yeah.
In dementia, certain cluster B personality disorders become much worse. For example, if you are diagnosed with narcissistic personality disorder and then develop dementia, your narcissism would be accentuated and become much, much more deleterious and egregious. So this is exactly what happens with borderline. The borderline is reduced somehow, ameliorated, mitigated, softens, soft edges, while the narcissism, the psychopathy, because psychopathy is also very common with borderline, other histrionic personality disorder, which is also very common with borderline, all these survive the borderline. And then...
Fascinating.
Yeah, the borderline is, think of the borderline as an invisibility cloak. So there's this invisibility cloak, and when it's tossed away, what's left is the Wizard of Oz behind the curtain. Then you see the true face of the individual.